Good morning and welcome to the Senate Committee on Commerce and Labor. Madam Secretary, please call the roll.
Senator Daley,
Here.
Senator Ellison, present. Senator Flores,
Present.
Senator Lang, Senator Rogish, Senator Scheibel, Senator Steinbeck, here. Chair Pazina.
Present, and please mark Senator Scheibel absent excused. We are going to start this morning with a bill draft request introduction. Committee members, as you know, throughout the session, we and other committees are asked to introduce committee bill draft requests, or BDRs, to begin the bill process, assign a bill number, and get it referred to our committee. Your vote today is to introduce the committee BDR, and it is not an indication of any support. It's just to get the bill process started. And today we have bill draft number 54-516. Do I have a motion to introduce bill draft number 54-516?
So moved. Second.
Thank you so much, Vice Chair. Thank you so much, Senator Flores. Do we have any discussion before we make a motion on the vote? Okay, all in favor, please say aye. Aye. Any opposed? Wonderful. The motion carries, and bill draft request 54-516 may now be referred. All right. With that, we are going to move to a quick welcome to our audience here in Carson City, as well as the people who are attending in Las Vegas and anyone attending online. Before we begin, I would like to make a few housekeeping announcements. I'd like to remind everyone to please silence all of your electronic devices in the committee room. Members of the public may provide testimony in various ways, all of which are listed on the agenda. You may also submit public comment in writing, either in addition to testifying or in the place of. If you wish to testify in person, please do sign in at the table by the door and leave a business card with our wonderful committee secretary. When testifying in person, please turn the microphones on to speak and off to listen, as we have a number that are also listening in Las Vegas as well as online. Please state and spell your name for the record. Anyone who'd like to receive electronic notifications of scheduled bills and access to the committee's meeting materials may do so by signing up on Nellis on the legislative website. Committee members will be using their laptops to view presentation materials and other exhibits. Please do not view this as a sign of disrespect or inattention. Also, I would ask that our presenters on Zoom today, as we will have a few, leave your cameras off and microphones muted until it is your turn to present, or if any questions have been directed your way. The Zoom video conference does have a chat feature. However, this feature is only to be used for technical assistance. Any information that you'd like to share during your presentation should be stated verbally on the record. And with that, we are going to get started with our first item on the agenda, which is a bill hearing for SB 47. And it's exciting to see our former Assemblywoman back in the building. Welcome. Please come on up to the table when you're ready and get started. Thank you.
Thank you, Madam Chair and committee members. I am former Assemblywoman Sarah Peters. I'm happy to be here today to help present Senate Bill 47 as part of the Washoe Regional Behavioral Health Policy Board for the last 5 or 6 years since I was appointed to that board. I've been really happy to work with my two partners here, who I will let introduce themselves.
Hi, for the record, I'm Dr. Kristen Davis Coelho. I'm a clinical psychologist, and I'm the vice chair of the Washoe Region Behavioral Health Policy Board. For the record, you spell my name Kristen Davis Coelho.
Good morning. For the record, I am Dorothy Edwards, Dorothy, Edwards, Edwards. I am the Washoe Regional Behavioral Health Coordinator and also staff to the Policy Board. Honored, delighted, and appreciative of your time today. Thank you.
Sarah Peters, for the record, as a former legislator and chair of the Assembly Committee on Health and Human Services, and as a member of the Washoe Regional Behavioral Health Policy Board, I have seen firsthand the challenges Nevada faces in ensuring access to behavioral health care. Throughout my tenure, I've worked on policies that strengthen our healthcare workforce, improve access to services, and address systemic inequalities. That is why I'm pleased to present this bill, which seeks to analyze and address disparities in behavioral health coverage and support the professionals who provide these critical services. This bill is the brainchild of the Washoe County Regional Behavioral Health Policy Board. We've included some slides describing the board, their intended purpose, and the history of bill drafts from the Washoe Board. You can read these at your leisure, or Dorothy can go through them if you'd like. But in summary, the board is made up of representatives from the community who all participate in some part of the delivery of behavioral health care. Our work during the last several legislative sessions under the leadership of Senator Julia Ratty included the creation and implementation of the crisis care model. You can see several of the bills from the last 3 sessions. Community-based care is the best form of care to ensure direct access for patients. Care needs of our community members range from intensive and acute, emergent, and triage services to maintenance care services similar to those of the physical healthcare system. Through the development and implementation of the crisis care model, the goal has been to ensure that there are community-based services interwoven with crisis services where there's no wrong door to accessing care. However, as most of us have experienced as community members and representatives, despite the policy and infrastructure being in place, the workforce still lags behind the need severely. There are several barriers to access we can immediately qualitatively identify. These include financial barriers such as insurance coverage, catastrophic versus comprehensive, insurance, including the design of your plan, included network adequacy, and income and wealth barriers such as high copays and deductibles or out-of-pocket maximums. There are also non-financial barriers, which include health system and resource barriers, such as community-based services. Are there community-based services where you need it? Or for virtual care, do you have adequate internet access? We also deal with non-financial barriers, including healthcare workforce. Does the workforce meet the community need? Dr. John Packham said it best, in my opinion: access is the ability to receive care when you need it. If you can't get care when and where you need it, you have barriers to access. The next several slides provide scenarios that give context to what parity is and why we are discussing it. You'll be grateful I'm not reading these verbatim, but you have copies of them to review at your leisure if you would like to, but I will go through the basics of all of these. In this slide, we meet Sarah and Emily, 2 Nevada residents with different medical conditions. Both need timely, effective care. Sarah has a sprained shoulder. Emily has depression. Both cases require immediate treatment and longer-term therapies. The scenario describes how the system works for each treatment. Their experiences, however, reveal a stark contrast in how our healthcare system treats physical and behavioral health conditions. In this slide, we meet James and Laura, 2 Nevada residents managing chronic health conditions. Both rely on daily medication to maintain their well-being. James needs blood pressure medication. Robert needs antidepressant medication. Both cases require long-term and consistent treatment for life-threatening diseases. However, their experiences with the healthcare system show a clear gap in access and affordability between physical and mental health treatment. The scenario describes how the system works for each medication. In this slide, we look at the scenario for insurance reimbursement for a medical clinic and a behavioral health clinic. In both cases, necessary treatment is provided to patients. The reimbursement process is vastly different. In this slide, we meet Dr. Carter, an orthopedic surgeon, and Dr. Patel, a licensed therapist. Both are dedicated healthcare professionals treating patients with urgent needs. However, their experiences with insurance reimbursement, prior authorization, and administrative hurdles reveal significant disparities between physical and behavioral health care. This scenario describes the patient load and schedule challenges, reimbursement and insurance hurdles, and provides an overview of job satisfaction and financial stability factors that could influence these specialists when determining where they provide care and for how long. In the next 2 slides, we summarize the takeaways from the previous scenarios. And what we see are barriers to access, inadequacies in care, and impacts to workforce that ultimately affect the economy from a system that lacks parity. From our shoulder injury versus postpartum depression, we see that there are systemic barriers to Emily's need for mental health care and SB 47 aims to uncover these disparities and push for fair and equitable coverage. In our heart medication versus depression medication scenario, we see that James is readily able to be provided his heart medication and get it through a generic pharmacy without prior authorization or step therapy. And in Robert's scenario, he faces multiple hurdles delaying his treatment. SB 47 aims to expose these inadequacies and push for policies that ensure mental health medication receives the same access and coverage as physical health medication. On this slide, we look at the reimbursement discrepancies in the previous slide, and we see that reimbursement for medical services is higher than reimbursement for behavioral health services. This is true regardless of the level of provider training or the time spent with the patient. Typically, our behavioral health care providers spend a significant amount of time with patients compared to their healthcare counterparts. Low reimbursement rates also make behavioral health programs unsustainable. We can look at the takeaways from our administrative burden and burnout slide, where we met our two doctors. And in these scenarios, the claim denials, pre-authorization requirements, and coverage limits cause behavioral health care providers to spend time doing paperwork instead of treating patients, unlike their physical health care counterparts. We also see an increased burnout from scheduling demands and paperwork requirements that cause providers to leave the field, leave the state, and stop contracting with insurance. So how does SB 47 address these issues? SB 47 is intended to strengthen access to care through policy reform. By requiring a statewide study on insurance parity, SB 47 will assess reimbursement gaps. Behavioral health care providers in Nevada are reimbursed typically 20 to 30% less than their physical health counterparts, forcing many out of the insurance networks altogether. SB 47 will provide the data needed to advocate for fairer reimbursement rates. Analyze workforce barriers. Licensing, training pipeline, and supervision requirements create hurdles for new professionals. This study will identify policy solutions to increase the supply of mental health providers and support evidence-based legislative action. This is where it's helpful for us. We cannot fix and we do not measure what we do not measure. This bill ensures that future workforce development policies are backed by data, not guesswork. In the previous slides, we discussed why this matters. To summarize the points, there continue to be gaps in parity metrics. How we identify how parity is met by insurance providers. Some of these disparities include reimbursement rates, denial rates, authorization requirements, and provider networks. Ultimately, what we see is that there is likely an economic burden carried by the state and local communities due to this lack of parity. Want to take this slide? Sure. Okay. So Kristen is our specialist in workforce, as she is a provider in the space of behavioral health care. So she drafted this slide. I'm going to let her go ahead and present on this piece.
Again, Kristen Davis-Coelho for the record. Workforce development, the mental health parity connection to workforce development isn't obvious, but in addition to being a clinical psychologist, I spent 10 years in administrative roles, building behavioral health programs and leading them. I'm trying to grow them in Northern Nevada. And so I had intense experience trying to recruit providers and build new programs. And the reimbursement rates connected to mental health parity were always a key factor in whether we could build those programs. So as Sarah Peters mentioned before, the reimbursement rates for medical providers and behavioral health providers are significantly different, again, regardless of how much training the provider has and how much time they spend with them. So when we're looking at recruitment of behavioral health providers to provide those services and grow programs, what we're seeing is that we cannot typically cover a behavioral health provider's salary with the reimbursement we're getting for the services they're providing. This is not typically the case for medical providers. They typically cover their salaries, their overhead costs, et cetera. And so again, as an administrator, when I would try to build a new program, we would literally have to build a budget where we knew we were going to lose money and decide how much money can we lose in order to provide these services to the community. It was always a negotiation in the budget room. And so you would try creative ways, right, to find other resources and other funding to build those programs, but eventually right? Grants run out, your program has to be sustainable. And so we see across the state, programs will be built. You've probably experienced this in your own communities. A program will be built, it will run for a period of time, and then it will close. And people won't understand why, and part of why is because of that lack of reciprocity in terms of the reimbursement rates and making it sustainable. So in terms of recruiting providers to the state, providers understand that reimbursement varies from state to state. They do their research. They look at how much they're going to make from insurance panels and how much the cost of living is. And when they look at Nevada, they see that our rates are significantly lower here. So it's hard for them to justify moving here. And we have those conversations with providers all the time when we're trying to hire them. As an organization, if you're trying to hire them, you can't offer a competitive salary because, again, you're doing this negotiation of how much money can I lose to provide these services to our patients. And then when they get licensed, right, they can go anywhere. And so they will typically find another state. They start off in Nevada, they do their training, and then they move to another state where they know that they can get equitable reimbursement. The same goes for the administrative burden. The amount of paperwork and prior authorization that is required is much higher for behavioral health providers than it is for medical providers. And so they will literally spend time dealing with insurance companies, talking to them on the phone, doing extra paperwork to try to get prior authorization. They have higher cancellation rates because the patient will schedule and then find out they needed prior authorization. And that sort of burden on the provider becomes a key source of burnout, where I would see provider after provider leave insurance panels, go into a private practice where they don't deal with insurance at all and only take self-pay patients. And the majority of Nevadans cannot afford to pay out-of-pocket rates to get behavioral health services.
Thank you. Sarah Peters for the record. Nevada consistently ranks among the worst states for mental health access, largely due to severe workforce shortages. Over 50% of Nevadans live in designated mental health professional shortage areas, and in some rural counties, there are no in-network behavioral health providers at all. Patients in crisis are often forced into emergency rooms, not because they need hospitalization, but because there are simply no available therapists or psychiatrists in their communities. Meanwhile, the mental health provider workforce is shrinking due to low insurance reimbursement rates, administrative burdens, and a lack of financial support for entering and remaining in the profession. SB 47 takes a data-driven approach to understanding these challenges, giving us the foundation for targeting policy solutions that will increase provider availability and improve behavioral health access. The next two slides are scenarios specifically related to workforce issues. I don't think we need to go over those because I think that Dr. Davis-Quayle went through this pretty well, but if you are interested in reviewing these scenarios and what happens in the real world from a healthcare provider to a behavioral healthcare provider, these are great scenarios to review. Our key takeaways from these particular slides include the difference between the access and wait times for care to patients from providers due to those administrative burdens, and then the provider challenges on not being able to focus on patients and instead focus on how do you balance an imbalanceable budget that doesn't cover the cost of providing care. SB 47 aims to address these systemic inequalities, ensuring behavioral health care is as accessible and covered as physical health care. Through looking at the impact of improved reimbursement equity, streamlined prior authorization, and reduced administrative burden, SB 47 will help us quantify the impact of future policy decisions on providers. Additionally, SB 47 aims to expose the disparities and provide data-driven policy recommendations that work to strengthen behavioral health workforce and reduce barriers to access. Again, there's some great information in these slides. I will let you review it at your leisure. The study is designed to work through several phases. Data has been collected by several different state entities, including the Division of Insurance, PEB, DHHS, and Medicaid, to name a few. Additional data gaps may be identified, in which case SB 47 offers a provision to allow the Division of Insurance to request this additional information with an option to compel the information be provided if there is resistance. This is an essential regulatory backstop to ensure data needs are collected from all essential insurance providers. This creates a level playing field of data. so it is truly representative of the state and the state need. Finally, data on workforce, licensing, and economic impacts will be used to identify the highest value policies that will make the most impact on the state's needs and bottom line. The bill requires the insurance commissioner to secure funding with a partner to contract third-party experts such as the Gwynn Center, a preferred vendor of the state that has completed studies in this area, including the recently published study on the impact of the pupil-centered funding formula. Updates will be required annually until the report is completed. The point of these annual updates is to ensure that as data is analyzed and conclusions and recommendations are prepared, legislators and policymakers are informed earlier rather than sitting on it until the entire report is completed. The study will be on the books until the report is completed and final conclusions and recommendations are published. This is another visual of the expected outcomes. In summary, SB 47 is a commitment to change. Nevada's behavioral health crisis is not just about patients, it is about the dedicated professionals who want to provide care but are being pushed out of the system. By investing in this study, we take a critical first step towards ensuring the behavioral health providers are supported, fairly compensated, and able to serve the community that needs them the most. I urge the committee to support SB 47 as a necessary tool to improve Nevada's behavioral health workforce, expand access to care, and create a system where mental health is treated with the same urgency as physical health. Thank you, and we welcome any questions.
Thank you so much, former Assemblywoman. We were just saying what a full circle moment this is, as you were the chair alongside our wonderful policy advisor last year, and now we're so happy to see you here. So, that said, do we have any questions from the members? Senator Rogich.
Thank you, Chair. Good morning, and thank you for coming today. With regard to emergency room services, could you expand further on that? So when a person is in crisis, they go to the emergency room and they're perhaps put on hold for 72 hours. Where do they go thereafter?
Kristen Davis-Coelho for the record. It depends on whether that person, the issue that they've presented with in the ER is determined to be resolved at that point. So they may go to an inpatient behavioral health program. They may be referred to an outpatient behavioral health program. They can refuse those if they are not on legal hold at that point. Or if their behavior becomes to a certain level, then the hold can be extended if it needs to be. Or they can often stay in that emergency room for hours or days or weeks at times if there aren't beds or positions for them to go into. Yeah.
If I may add, Sarah Peters for the record, I often heard from constituents who were complaining that they were released from the hospital with no soft landing place. And that isn't a product of inadequate system response. It's a product of these facilities not being able to keep their doors open or enough beds available to the people who need them, right? This is a workforce challenge. They don't have enough care providers to ensure that the folks who need that service coming out of an emergency room situation have that landing. Additionally, there are barriers to insurance covering those beds. And so if a person doesn't have insurance that covers the one bed that's open at the facility that's available to them, they can't go. Who could afford that?
Kristen Davis-Coelho for the record. There are, it happens often that there will be a behavioral health, like an inpatient treatment center, right, where patients hypothetically could go, but they will have to close floors of their treatment facility or sections of their treatment facility because they don't have the staff, the therapeutic staff, to provide services in that. So they will have beds sitting open, ready to be used, but either no therapist, no psychiatrist, no psychiatric nurses to be able to provide that care.
Thank you very much. And also thank you very much for the presentation. Senator Ellison.
Thank you, Madam Chair. It's good seeing you again. I've got a couple questions. You know, a lot of times the cities and the counties, you know, they put so much into emergency rooms, you know. I can't remember what Ilko County does, million something a year, I think. But there's such an influx of people, it runs out of money. And then a lot of people are denied or sent home. this bill is going to help offset a lot of that. Is there any reimbursements from the cities or counties? Have you discussed this? That this money could actually go instead of the emergency rooms is to facilities like this? That's my first question.
That is a great question. Sarah Peters, for the record. The goal of the study is to collect data from these different entities that are participating in behavioral health care provided services, right? And that comes from insurance and healthcare facilities and our states and counties who are responsible for providing services to different demographics. And with the goal of looking at how can we address the policy needs of this area to best build economic stability, workforce stability, and essentially patient care stability, right? So that we have a system where patients go where they need to go when they need to get care, instead of, I can't go, there's no beds open, I can't find a provider, there's no in-network access for me, now I have to go to the emergency room, in which case the local governments often cover the cost and the burden.
And Paulo, and I know that we've had a lot of meetings with in government affairs, you know, where the cities and the counties are now providing, helping getting more facilities built in. And I know the chairman here has worked hard with these cities and counties to look at some of these facilities. You know, and it all comes down to MONEY and where this money is going to come from and how they're going to do it. Is a need there? Yes, it is. So it's going to be a rough road to hoe, but there's so many requests, and I don't know what they're going to do to resolve the issue, but they got to do something. But thank you. Mm-hmm.
Yeah, thank you for bringing that point up. There is a huge pressure to find additional funding sources for behavioral health care. But there's also a lot of wasted funding in behavioral health care, in part because we're not able to provide those preventative treatment services early when someone needs it. We could provide basic postpartum care for women after they've had their births to ensure that we catch postpartum depression early. But that's not a part of the treatment protocol for women in the state of Nevada. That's an area that could be addressed. We could look at what does additional soft landing or soft handoff look like within the crisis care model system, so we're not holding people in these expensive triage centers when they don't need this expensive triage. But again, the biggest barrier we've come across is just the people who want to do it being available to do it in the state of Nevada. Like Dr. Davis-Cuello said, they come here, they train under our professionals, and then they book it because they are not getting the same reimbursement rate and salary that they find in other states. I want to point out specifically that I know there are mixed feelings around studies and the effectiveness of studies, but I think what we see in this particular area is data is being collected from a variety of sources and nothing's happening. So the goal of this bill is to bring it together with experts in the field of data analysis, data analytics, and policy development to come up with some rational solutions, some functional problem solving, to put that money in the system in a different way, to build that economic resiliency in healthcare workforce, and to bring more people to Nevada knowing that stability exists.
Okay, Senator Steinbeck and then Senator Lang. Everyone's so polite this morning.
Thank you, Madam Chair. Thank you for bringing this bill. My question is, in the bill it says that the insurance commissioner, to the extent money is available, would have this study. Do you have any idea of the cost of this study?
Thank you for the question, Sarah Peters, for the record. This study, to me, is budget limited, right? There's a lot of data that's already being collected, and so we can start with a nominal amount of funding to get things moving and start processing that data. But the more money available, the more robust that analysis can be. We have been in discussion with the Gwynn Center about what it could look like for them to be the third-party partner. They are well positioned to look for those dollars, where the funding can come from to help the state pursue this study, and they would be able to build budgets based on that, what money is available. We wanted to make sure that it was a bit open-ended so that it could start with a nominal amount if that's available, and then grow as money becomes more focused or centered around workforce development, as more grant opportunities were able to be written to and applied for, et cetera. We also we wanted to be cautious of requiring the Division of Insurance to take on this study without money, so it wouldn't happen if there's no money there.
Right.
Yeah.
Oh, so this, follow up, thank you. So the scope of it would adjust to the money that you're able to find through the grant process, donor process, or normal budget process?
Sarah Peters, for the record, that's the intention, and I don't think it will be hard to find funds to support this effort. We are able to find funds to support workforce development already, right? This is just a pivot from general workforce development and healthcare to specifically behavioral healthcare workforce, and the interconnectedness of parity in insurance and that workforce.
Thank you.
Senator Lang?
Thank you, Madam Chair. So in section 4B6, where it talks about step therapies, could you just expand upon that a lot? Because I've done a lot of work in getting rid of step therapies, because we always go to the lowest common denominator. So when I see this, I'm like, I don't want that in the bill, right? So if you could explain that to me, I'd really appreciate it.
Sarah Peters, for the record, and I would defer to your legal counsel on the interpretation of this. But in section 4, we talk about the study conducted must include without limitation a comparison of the terms under which health insurance insurers in the state cover behavioral health care to the term under which such health insurance covers other forms of medical care, including without limitation step therapy. So the intention of this is to look at, is step therapy being covered by insurance in a commensurate way to a physical healthcare model? So it's not looking at the application of step therapy as a solution. It's looking at, is step therapy become a burden to behavioral health care access? Does that make sense? And it could maybe be worded a little bit differently, because this whole section relates to things that cause problems, that we know cause problems, right? Adequacy of networks. We see problems in rural communities around network adequacy. Rates of reimbursement, as Dr. Davis-Coelho mentioned, those are often under parity with physical healthcare reimbursements. Incentives offered by insurers to providers of healthcare. Are there incentives for behavioral healthcare providers such as healthcare outcomes, right, that insurance providers sometimes will bonus a physician on? Rates of denial of coverage. Do we see a higher rate in one side or the other, and is that commensurate with the other side? Prior authorization similar, and then do they provide? I've never heard of somebody who was required step therapy for heart medication, but I hear it all the time for depression medication. So that's the intention of this section of the bill and why we want to include it in the study.
Okay, thank you so much. And I just wanted to confirm, I noticed there's no fiscal note on SB 47, so you're looking for the money to conduct the study from grants and gifts and not asking for money from the general fund, correct?
At the moment, sorry, Sarah Peters, for the record, that's how it is written. I think there is an ask for a state obligation to get some contractors to start looking for and applying for grants. But that's a separate conversation from the policy side. Additionally, I do expect there to be fiscal notes. We just haven't seen them yet. And I think we'll probably get fiscal notes from the Division of Insurance to manage this. I have not been able to get them on the phone to talk to them about it. I expect they're probably pretty busy with some of the other things that they're dealing with and triaging at the moment. So I anticipate we'll see a fiscal note from them in the future. There may be fiscal notes from other entities identified in the bill as providing data, because that is a manpower cost, right, to be able to give that data to the third party. And then some local governments, I anticipate those that have the self-funded plans for their staff may also provide a fiscal note saying that providing this information will be a burden to them. But we haven't seen any come in yet.
Thank you so much. And I think we have one final question from our vice chair.
Thank you, Madam Chair. And I was just thinking of this, and maybe you can help just bring full circle, because the mental health care parity, relatively speaking, is a newer section of the law that has to be implemented by insurance providers across the board. Previously, mental health care was restricted to a number of visits, lifetime limits, quite a few different things and now all of that stuff has to be transitioned out. You can't have a lifetime limit, you can't limit the number of deals. So this reminds me, and you can tell me what state we're in making that transition, and I think that's where we're here on that, because are we actually getting the parity with the medical side of it? And I think you're trying to figure out if the insurance companies are giving it lip service, or if they're, because everybody's still trying to, cut the costs and find the lowest common denominator. The other thing that mental health was always covered if there were exclusions, if it was a self-inflicted, and all of that stuff is gone now, right? So you have to treat the underlying issue for the reason the person was, was under the influence of alcohol and got in a wreck. So you still have to cover that the same. And it reminds me of the same conversation we had when we were trying to stop people from going to the emergency rooms for medical treatments. What are the underlying issues, and how can we do the preventative to that? And I hope your study, the update on the mental parity, actually how it's being implemented, is what my question is. But I think the study will reveal the same as we found on the medical side. There's savings if we do the preventative work. We just need to get the data and prove it.
Kristen Davis-Quayler for the record. Yeah, that's exactly right. There's a lot of cost savings, and that's part of this study, is looking at what are the outcomes and the results of providing inadequate behavioral health care, right? So we know that there are costs associated with involvement in law enforcement, emergency room care, disability and unemployment services, right? That need to be provided for folks that are not able to work because they're getting inadequate behavioral health care. Lots of different costs. So that is part of this study, is to look at really quantitatively, to apply numbers to what are those costs. The other piece is that the Department of Insurance, I think starting in 2021, insurance companies were required to start reporting on mental health parity, whether they were meeting those requirements or not, because hypothetically, yes, we're supposed to have mental health parity at this point, but from boots on the ground, everybody knows that's not the case. And so the first report that came through, the data was fairly scattered. They were getting different information from different insurance companies, and it was hard to sort of make sense of. The most recent report, which I think came out this last year, was still very limited in the data that was received by the Department of Insurance, even though it was a requirement at that point. But it did show pervasive discrepancies between physical health and the mental health. So, I mean, it really did show, for the amount of data that there was, it did show that we really are not meeting that requirement.
Understood, and I asked the question because I know the insurance plan that I'm aware of and work with all the time is we do the best we can. We try to do the stuff, and we're a not-for-profit insurance provider. But I think it's more, people are trying to make it look good on paper, and I think that's what you're trying to cut through is it actually got the same parity? Because everybody's making it look good on paper. So
Sarah Peters, for the record, we're not the only state doing this either. We see several states, Washington, or some other ones, California, I think like Illinois and Minnesota have also gone through the effort of looking at how is parity affecting their communities. Because the federal laws, only go so far in looking at the aggregate data, right? So in some states where they have more strict regulations on insurance, that looks different. When Medicaid is provided in a different way in a different state, it can wash, like if California provides more behavioral health care, it can wash out what we're seeing in Nevada. And so I think the states are interested in what parity looks like for their constituents, because the federal directive is not telling the full story for a state such as Nevada, where we have these urban centers and cores, where we have majority of people not on state-run plans, where we have a high use of Medicaid and these provider network or these provider shortages, like just pervasive through most of the state. So I think we're not the only ones interested in this piece. And I think that the more work we can do at the state to look at what's affecting constituents on the ground, the better our federal delegates can also do when looking at what does overall federal parity metrics look like. And then we can stop micromanaging at the state level, right? And let the way the law is supposed to work from the top down in the federal, from the feds.
Okay, thank you so much. We'll have you step back from the table. Thank you so much again for the presentation. And we are going to open this up for testimony in support of Senate Bill 47. We'll start in the physical locations in Carson City and Las Vegas.
Good morning, Chair, members of the committee. My name is Spencer Flanders. I am with Tri-Strategies representing the Nevada Psychological Association. Yesterday was Behavioral Health Day here at the Legislature, and we spent the day talking about the challenges Nevada's face when it comes to mental health care. And the truth is, we are in a mental health care crisis, and people are struggling to get the care they need. This bill is an important step by calling for a study to see if insurance plans in Nevada are treating medical health care as the same as physical health care. Right now, many Nevadans face barriers to care, and because mental health coverage just isn't on equal footing. By auditing where we stand, and we can see what needs to be changed. This isn't about red tape, it's about understanding the gaps so we can fix them. It's about making sure Nevadans are getting the care they're entitled to. That's why the Nevada Psychological Association is in strong support of this bill, and we're asking for your support too. Thank you.
Drop the mic.
Good morning. My name is Dan Musgrove. I'm with Strategies 360, and I'm also a member of the Clark County Regional Behavioral Health Policy Board, as well as the Children's Mental Health Consortium. And I have a number of clients that are deeply involved in this issue, and it would take longer to name my clients that are concerned about this in a good way than it would be to use up my 2 minutes. So I wanted to make sure that I congratulate the Washoe County Board. This PowerPoint that you have before you is one of the greatest examples I've ever seen of the difference between what we see as providers in what is the lack of mental health parity. It is shocking what providers have to go through in the state of Nevada to try to bring behavioral health services to folks who desperately need it. I always feel like I'm the old guy in the room when I start talking about how long I've been working on this issue here at the legislature, but I can tell you back in 2004, when I was a county lobbyist, the county manager at the time declared an emergency situation in Clark County because 1 out of every 3 hospital beds were filled with someone going through a mental health crisis. And that caused a tremendous lack of access of care for people who needed acute care beds, when a hospital is probably the worst place for someone who is in a behavioral health crisis to be at. And the proponents of the bill named you numerous reasons as to why it's important that we look at this. And I can tell you that every provider that I have experiences, whether it's hospitals at the acute care level, whether it's behavioral health hospitals, whether it's providers that do substance abuse and outpatient therapy, it's a tragic situation that this study, I think, will bring light to, and I congratulate them for bringing it and hope you help pass the bill. Thank you.
My name is Robin Reedy. I'm the executive director of NAMI Nevada. That's the National Association of Mental Illness here in Nevada. I am in support of this bill. I will give you one piece of data. Yesterday, a 16-year-old girl in Elko County completed suicide. We are dead last in mental health services. Take dead quite literally. We can argue over policy. We can argue over dollars. Are we going to argue over her grave? The least that the legislature can do is pass a bill to get data that I'm always asked for when I come to testify. Data to prove that most of the policies that we support, therapy medication bill, that step therapy medication pill will probably be wiped out by the draconian cuts made last night in the federal government. Nevada needs to insulate themselves from being unable to provide what minimum services we provide as it is. Now, you will hear people saying that this will cost money because they will have to provide a report. But again, data is power. I went to look for testimony on parity, and I saw my testimony since 2015. I have been doing work for NAMI Nevada since the last 16 years. I ask for your support of this bill in the name of people who have completed suicide, people who are considering suicide. Thank you.
Good morning, Madam Chair and Committee. My name is Jalen, Jalen, last name Wise, W-I-S-E, with Silver State Government Relations, representing the Nevada Advanced Practice Nurses Association and Vitality Unlimited. Both of these organizations provide behavioral health services and think that this study will be very important moving forward with their care. Thank you for your time.
Thank you so much. All right, seeing no one at the table in Las Vegas, broadcast, do we have anyone on the phone lines?
If you would like to testify in support of SB 47, please press star 9 now to take your place in the queue.
Good morning, Chair Bazina and other members of the Committee for Commerce and Labor. For the record, this is Valerie Haskin, V-A-L-E-R-I-E, Haskin, H-A-S-K-I-N. As the Rural Regional Behavioral Health Coordinator, I'm here to speak on behalf of the Rural Regional Behavioral Health Policy Board, who supports this bill for all of the reasons mentioned during the presentation and also discussed during Q&A. A quick note that's a little bit more specific to some of the other testimony given in support of this bill. The Rural Regional Behavioral Health Policy Board serves Elko County as well as Eureka, Humboldt, Lander, Pershing, and White Pine. Within the region that is served by the board, there's actually a much larger percentage of the population that is covered by private insurance due to mining and other companies like that. So this particular bill that would have the opportunity to explore issues with parity really has a lot of meaning when it comes to getting private insurance companies to really understanding what the issues are there. And who knows if that could have potentially been an issue that could have resolved the issue for the young lady that Ms. Reedy discussed earlier. Thank you.
Good morning, Chair Pazina. My name is John Etzel, Johnetzell, Executive Director for Boys Town, Nevada. I would concur and urge support for SB 47 for all of the reasons and all of the great data that's been presented here today. Thank you very much for your time.
Good morning, Madam Chair and committee members. My name is Steve Shell, S-H-E-L-L, and I am here today to express my support for SB 47. I am chair of the Washoe Regional Behavioral Health Policy Board. I apologize that I was not able to attend today's meeting with Vice Chair Dr. Kristen Davis-Coelho and Policy Board Coordinator Dorothy Edwards, along with former Assemblywoman Sarah Peters, who has been our champion for bringing more awareness to behavioral health insurance parity in Nevada. I believe parity is one of the most critical issues we are facing at the moment. Despite federal mental health parity laws, we still have too many inconsistencies in reimbursement, denial rates, authorization requirements, and provider networks that all have a profound impact on the mental well-being of our Nevada residents. We are proposing a study on the parity between behavioral health care and other medical care in public and private insurance plans in Nevada that we strongly believe will give us the data to better understand if the behavioral health needs of our residents are being treated fairly and at the same level as the medical needs, as well as ensure that we are truly in compliance with federal mental health parity laws. We seek your support in moving this bill forward. Thank you for your consideration and for your service to our great state.
Thank you.
If you recently just joined us, oh, I'm so sorry, Chair.
No worries. I was just going to say we're going to come back in person to Carson City, and then if there's anyone else online, we'll go back to online. Thank you so much.
Thank you, Chair, for your indulgence. I apologize for my delay coming to the table. My name is Sabrina Schnurr. I am here today on behalf of the Nevada Psychiatric Association. Many of the testimony in support has already spoken much better words than I could today, so I just wanted to throw in our hat to say that the Nevada Psychiatric Association is also in support of SB 47. Thank you.
Thank you so much. And with that broadcast, is there anyone else in support of Senate Bill 47 on the phone lines?
If you would like to testify in support of SB 47, please press star 9 now to take your place in the queue. Chair, you have no more callers wishing to participate at this time.
Thank you so much, broadcast. With that, we will close support on Senate Bill 47 and open up testimony in opposition. Please come to the tables in Carson City or Las Vegas if you wish to testify in opposition. Not seeing anyone coming up to the tables, which is always a positive development. Broadcast, do we have anyone on the phone lines in opposition of Senate Bill 47?
If you would like to testify in opposition of SB 47, please press star 9 now. Chair, you have no callers wishing to participate at this time.
Thank you so much, and we'll now move to neutral. For Senate Bill 47, please come on up to the tables in Carson City or Las Vegas.
Good morning, Chair Pazina and committee. I'm Shelley Capurro for the record, representing the Nevada Association of Health Plans, an organization comprising 10 health plans that operate in both the public and commercial markets. We appreciate the opportunity to convey our concerns with the added procedural and administrative reporting mandates of SB 47. We are completely in alignment that mental health is a critical issue to Nevada, and we value and commend the collection of data and research conducted to better improve mental health in our state. We are here to share with the committee that currently our member plans in Nevada are required to collect and submit an extensive amount of data through the Department of Insurance, and beginning this year, we will be required to utilize the All Payers Claim database to submit additional information. In an attempt to avoid overlapping efforts and prevent duplicative reporting that can lead to confusion, we're happy to report that we have already started conversations with former Assembly Member Peters, and we look forward to continuing those conversations with her and the Washoe County Regional Behavioral Health Policy Board. Thank you.
Thank you. For the record, Adam Plain, P-L-A-I-N, with the Nevada Division of Insurance. We are testifying neutral today as a matter of policy on this particular bill. I would like to first apologize to the Behavioral Health Policy Board. We did have several conversations with them over the interim, and as they so generously gave us the benefit of the doubt, things have gotten busy recently, and so we will be reaching out to discuss the particular bill further. I did want to clarify as well that the division has submitted a fiscal note. I checked as of 7:30 this morning. It wasn't in Nellis. I don't know why, but we did submit the fiscal note. We submitted it gross of any grant collections, right? What we expect outlays to be under the provisions of the bill. Just to put it on the record currently, we estimated in the first fiscal year a low of about $210,000 to a high of $665,000, and in subsequent fiscal years a low of $925,000 to a high of just under $3 million to run the data collection, the additional examinations required under the bill, and do those particular items, again, without consideration of any receipts under the grant provisions. If there's any questions from the chair or the committee, I'd be happy to answer them.
Okay, thank you so much. We appreciate your testimony and update. And with that, and seeing no one in Las Vegas testifying in neutral broadcast, do we have anyone on the phones?
If you would like to testify neutral on SB 47, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to participate at this time.
Thank you so much. If you have a very quick closing statement, you're welcome. Okay. We thank you so much, former Assembly member. It's so wonderful to see you. We appreciated the presentation from all of your team. And with that, we will close the hearing on Senate Bill 47, which provides for a study of certain issues relating to insurance. And we will open the presentation on SB 165, establishing provisions relating to behavioral health. And we will welcome Senator Wynn and her co-presenters. And speaking of full circle, I believe in the 2021 session, you chaired the committee where, again, our policy advisor served. So a very full session, very full circle day.
Good morning, committee. I am very excited to be here. My name is Rochelle Wynn, and I proudly serve Senate District 3 here in the state of Nevada, in Southern Nevada. And I am super excited today to present Senate Bill 165. I'm proud to present a bill that I'm hopeful that this legislative body will also come to support and be calling me after I leave, asking how they can become a co-sponsor on this bill. I truly believe that this bill will change the landscape for how we address the challenges we face as a state around children's mental health. We heard some horrible statistics about how we rank dead last and what we need to do as a state in order to ensure that we are no longer dead last in any of those rankings, I think is super important, and I know that this bill will go an incredible way to change the landscape of how we address our problems. For those of you that have had the opportunity to hear me present a bill in the past, I like to start with my origin story on how the bill became a bill. I know I'll have at least one fan in our shared love of and fandom of superhero origin stories with Senator Daley, so I think he will appreciate how that has come to be. I remember it was about 2 years ago. It was right at the end of the legislative session, the last legislative session, and I received a call from my city councilman, Brian Knudsen. I have a hard time saying no to him, and he said, hey, I'm collecting a bunch of people that really want to start working on 2025 legislative priorities. And it was the first time I was like, this is what we need to do. We need to start working on this now. We need to start working on this early. So I didn't know what I was getting into. I knew that he was pretty good about bringing people together. And I walked into a room, and there were probably about 50, 55 professionals that worked in the mental health that really had a focus on children's mental health and what we needed to do as a state. Also at that time, there were some representatives from the Balmer Institute that had come down to kind of give a presentation on what they were working on in the state of Oregon. And for those of you, you will learn, we have a representative from the Balmer Institute on the Zoom to answer any questions that you might have about this program. What I loved about the passion, the fear, the motivation, and the organization is it was finally a group of people that came together really under the leadership of the Children's Advocacy Alliance in wrangling cats and getting everyone together to keep us on focus, to figure out what we could do to put together and present an actionable plan in the next legislative session. And that is what we have for you here today. So what does this bill do? It creates a brand new workforce. It creates a brand new bachelor level degree and trains Nevadans to go out into our community and be able to do work immediately, be able to be a part of the solution in getting us out of the bottom 50 in the area of mental health. What does it do? It also creates a new licensing structure, and it also helps these people get paid to do these professions and do this new career. I am going to turn this over at this time. Like I said, we have Courtney Wessling from Government Affairs from Balmer Institute that's available to answer any questions. She will be online. We also have Dr. Tara Rains here, the Deputy Director of the Children's Advocacy Alliance, that is going to kind of walk you through some of the high-level aspects of Senate Bill 165. And I also have Dr. Michelle Paul, the Assistant Vice President of Mental and Behavioral Health at UNLV, to also walk through and answer any questions that you might have about what this bill does and what our intentions are about going forward. I will also say that there are some issues that we are still working forward. So I plan on having a lot more working groups and conversations, especially around the insurance payment piece. I know we have some things to work through with federal defrayal, as well as some of the insurance coverages and some of the issues. So I know that at this time, there are some people that will be coming in opposition, but I'm hopeful that we'll be able to work with them and work with those parties to get them to a place where this bill is a bill that can move forward with even more partners that are part of this collaborative process. So with that, I will turn this over to Dr. Rains.
Thank you, Senator Nguyen. Good morning, committee. Thank you so much for this opportunity to present. I have a few slides that I'll go through that offer a high-level overview of what we're hoping to accomplish with this bill. And then we'd like to open it for questions, and hopefully through your questions we can fully explain what our goals are. So thank you again. So with SB 165, what we're hoping to do is use a bidirectional approach to building our mental health workforce here in Nevada. So we know that we don't have enough practitioners for the children specifically who are experiencing high-level mental health needs and challenges. And it would take years and years and years to build up that workforce to meet our need. Meanwhile, the number of children moving into severity increases every day that we don't have practitioners to meet their needs. So the first part of this bill will propose a prevention-oriented profession here in Nevada so that we have a workforce that can work to support the youth when they have early warning signs of mental health disorders and do some of that preventative care so that they don't all escalate to blossoming into full mental health disorders. So if we look at this from a medical perspective, these are the people who would be helping to coach the people who have high risk factors for heart disease, right? So these are the coaches, these are the people who would support you in not eating McDonald's every day and not smoking a ton of cigarettes so that you reduce your risk factors for later developing a more severe health disorder, right? So we want to, and I'll talk more about that in a minute. The second aspect of this bill supports our doctoral level practitioners. So currently, and we'll talk about this, we don't have an APA accredited internship here in Nevada, which means folks pursuing doctoral level training who want an accredited internship experience, which is required for lots of different professional avenues, have to leave the state to get that experience. Right? And so we want to create an internship here in Nevada. The third part of this is investing in workforce through scholarships. We know there's a high cost burden to folks who are pursuing degrees in behavioral health, specifically child behavioral health. And so we want to incentivize students to pursue degrees in this field through scholarships. So, and thank you to our friends at the Balmer Institute who shared some of these slides with us. Our youth mental health crisis, we know if you look at this graphic, there are three types of students. There's students who have low risk for mental health disorders. Those are our dark green leaves. We have students with some risk, higher risk for mental health disorders, and those are our kind of wilting a little bit leaves. And then those yellow kind of dead leaves are students at highest risk for mental health disorders. And we know in the last 10 years, the number of students with highest risk for mental health disorders is growing. So with our current workforce, what we have, and this is a national perspective, it's probably even lower than this in Nevada, we can only, at our current capacity, serve a very small number of those students who are having severe mental health distress and disorders. We're not able to reach the students who are at higher risk for these disorders, and we're not able to support the students who are at low risk to make sure they have the skills to not move into those more severe categories. Oh, that didn't work. What this graphic was supposed to show was how with our prevention-oriented workforce, we would be able to capture all of the students. And so essentially, we would be able to, if you could imagine a square around all of the kids, right? Because with these bachelor's level professionals, we'll be able to offer skills to these kids to make sure that they stay at this level, and we'll be able to offer low-level interventions and supports to these kiddos to help them get back to the green, back to the flourishing. And so we're hoping to do that work with the development of the behavioral health and wellness practitioner workforce. And I'll let Dr. Paul, who is representing our work together with all of our Nevada universities, talk a little bit more about the internship.
Good morning. I am Michelle Paul, for the record. I want to acknowledge for a moment the collaborative effort among the NCHE institutions and recognize my colleagues in the audience from UNR and Great Basin. We've worked together on a number of pieces related to this bill along the lines of developing the curriculum and putting in place through NCHE what's going to be needed to execute this bill. I'm specifically going to speak about this particular slide. In Nevada, in order to become a fully baked psychologist, you need a child psychologist. You need to have a year of residence training, in-residence training. There are APA accredited internships or residencies for psychologists for adult serving professionals. But there are 0 child accredited residencies for psychologists. And so Nevada's current doctoral training programs for psychologists and expanding doctoral training programs for psychologists that want to emphasize building up the child mental health workforce, which is part of the reason why we are last in the nation, have to send their students out of state to get that required residency training in order to get those degrees, and it's much harder to bring them back. I want to acknowledge my doctoral student, one of my former doctoral students, Dr. Mallory Constantine, who did this slide for us. And it makes it very clear that Nevada, compared to our neighboring states, has 0 accredited internships. Why psychology in particular? Psychologists have a unique skill set aimed at meeting the unique needs of neurodevelopmentally compromised children that need that higher level of care around the ability to not only do the assessment, but high-level, comprehensive, complicated diagnostic pictures like autism, complicated neurodevelopmental disabilities and so forth. And so in order to have those folks stay here, we need to develop on the other end of the spectrum, in addition to the prevention workforce, that higher level specialist workforce as well.
I think we are open for questions right now, if you'd like to go to those, Chair. And I'm sorry, Rochelle Wynn for the record.
Thank you so much. Do we have, okay, Senator Rogich and then Senator Flores.
Thank you, Chair. Thank you for coming and discussing this important issue. I don't think we need to debate the fact that all of us likely can agree that we have a moral obligation to help these children, and they need to get the services that they need, that they deserve to receive in this society. And so I personally have lived through it with our family, and so I appreciate all that you're doing and I support it. Thank you.
Thank you, Senator.
Thank you so much. Senator Flores.
Thank you, Madam Chair. Excuse me, and thank you for coming by my office yesterday and providing some feedback. I really appreciate that. You know, I was curious to know, is this work that we are seeing being done already? For example, prevention specialist, is this something that's happening already? And if not, can we decipher between the two? If you could walk us through that, please.
Thank you so much for that question. Yes, my name is Tara Rains, again for the record. And what we're finding is that many of the workforces that we have in Nevada that may do some of this work are focused on adults and focused on substance use, right? The other difference is we have some folks who are able to do some of the skill building, but the youth must have a diagnosis before those folks can bill for those service or can really work with them. And so what we want to do is, if you think of it as, in schools often they use the multi-tiered systems of support, right? We want to offer support for those kids who are at the universal level so that we have someone in the building who's able to do some of those evidence-based interventions for all kids, and those kids that have not necessarily fully exhibited enough of the warning signs and symptoms to warrant a diagnosis. We want to get them before they hit diagnosis.
And Madam Chair, if I could have a follow-up.
Yes.
And focusing on the...
Sorry.
I appreciate you and Madam Chair. Thank you. Thank you for being here.
So sorry.
No. You inferred that if I could ask another question, and you politely said yes, so thank you. I was curious, you know, you were talking about the front end and back end. You know, maybe we could move into that conversation a little bit when we talk about money, right? I think so often we engage in that conversation if we front load versus approaching things on the back end when it's too late. What does that look like? And have you had conversations about cost and insurance providers saying that this may be something that may be too difficult to start engaging with? Just talk to us a little bit about money, please.
Yeah, so we've had early conversations around what the cost will look like. As Senator Wynn stated, we have to have more in-depth conversations about that. From our perspective, this is cost savings, right? Because if we offer youth the tools that they need to be successful from a mental health perspective, and we can really get on the front end, we'll have fewer kids in crisis. We'll have fewer kids involved with the juvenile justice system. We'll have fewer kids in emergency rooms for mental health crises. We'll have fewer kids getting those 72-hour holds to stabilize, right? And so we know that a lot of those kids who are experiencing these mental health crises are on Medicaid, right? And so we're hoping that this will, in the long run, by investing in prevention and offering these skills, will save the state money in supporting mental health care for severe mental health disorders and also in juvenile justice interaction.
Thank you, Madam Chair, and thank you again.
Okay, we're going to go down the line, and we'll head from Vice Chair Daley to Senator Lang to Senator Steinbeck, and then back to me.
Thank you, Madam Chair. So real quick, just easy question first, then I got a couple technical questions. But so you're putting this under the Psychology Board. Can you just give us an explanation why it, I think I know why it fits there, but if you could just explain why you chose them instead of creating their own board, et cetera.
I'll take it. The Psychology Board has a history of supporting bachelor's levels professionals here in the state. So the Psychology Board at one time did house the ABA therapist, and so we felt with their experience and how they are adjacent to the field that they would be a good fit to house these professionals.
It sounds good, because I'm usually all in favor of not creating new boards, but so along those lines, the second, more of a technical question regarding the advisory group that you guys are putting. I think it's in section 14. A lot of times, do you have goals specified on what you want the advisory group to do? And then if they accomplish those goals set out, that you can automatically end the advisory group rather than have it go on. Because as we see, there's these advisory groups get set up, and then 25 years later, there's nobody on them. They don't have anything to do. They're not meeting, and then we have to pass a bill to get rid of them. So just a thought on that. You don't really have to answer. Just a thought idea on that.
Rochelle Wynn for the record. No, I appreciate that. I think our intention was, as we're developing this new profession and we're developing the scope of practice, we're developing what this looks like moving forward, we wanted to make sure that we had actual professionals that were in this space being able to guide the development of this profession. I know that you serving on our sunset committee, I'm not opposed to considering sunsetting this when it no longer is necessary. So it's definitely something we'll take into consideration when we're going back, fine-tuning some of the details of this bill.
And thank you. And it's not that we're against it and you shouldn't have it. I think it makes sense. Give them some goals, some things to hit, and see if they can meet the established parameters that you're looking to get, and if they've done their work, then we should look at that. In section 11, and I just want to understand where it says behavioral health promotion and prevention, it says what it means, and then you list all the stuff that it doesn't mean. So what is it that they can do? I just, because I'm not in this profession, but in theory, I suppose they can do anything that's not listed and prohibited there, but what is the goal that they can actually, or that behavioral health promotion prevention is?
Rochelle Wynn for the record. No, I'm actually glad that you brought up a question regarding that section. That is one of the sections that we were really going to have to actually do it. I hate to use this term, a deeper dive into, because there are some concerns with the Department of Insurance, and I think they're warranted, where we are going to have to look at how this potentially triggers some federal defrayal issues with our participation in the ACA and some other things. So it's definitely something that we are going to continue to work for. I think what we were intending when we created this section was to kind of further distinguish from how this is different than other professions. So I'll turn that over to Dr. Rains to kind of further describe where this profession will fall in, I guess, the landscape of mental health treatments. Yeah.
Thank you, Senator Wynn. Tara Rains for the record. When we look at this profession, we know there are a number of evidence-based interventions that help reduce the development of mental health disorders that our currently trained professionals just don't have time to execute because they're for the kids who have not been diagnosed, right? And so this is a profession where folks will be implementing some of those interventions, doing some of the work maybe with small groups of kids, maybe working individually with kids, engaging in some of the screening practices that we know can help identify early warning signs of mental health disorders. And so taking that front end work off and not engaging in the more intensive therapeutic intervention assessment type activities. Is that helpful?
Yes. Yes, and I, I'm glad you have to do a little more work on that, because when I read it, I'm kind of going, all right, how does all this fit in? And I was just curious on that question. I see all the stuff they can't do, so what are they gonna do? Final question, and it's just a technical one on the fee, and it's something to be clear on, because when someone does the application, I think it's under section 15, is that they have to fill out the application and they have to turn in the fee established by the board. It seemed to be confusing, that language established somewhere else, but the fee is established someplace else, not necessarily by the board. You're putting it in statute, so the state is kind of doing that when we set that. So is there any confusion there on that the board can set the fee absent some of the rulemaking process or various things? It was just a technicality thing you might want to look for clarity on as well.
Rochelle Wynn, for the record, is definitely something I have on my to-do list here, and I appreciate that. I know that you have so much experience that you bring to reading this, and I know you read every 130-something page of this bill. That can be guaranteed. Just to kind of, supplement this, we wanted to make sure that this new workforce is there to help and to build up our system and not to replace any workers. We envision them working alongside social workers and other mental health professionals, not against them. They are not going to be doing any diagnosing or therapy. And so I know you had asked, well, what are they doing if they are? As Dr. Rains had said, it is a step early before things get worse. And it's also a recognition that we have already strained resources. The reality is we're never going to have enough child psychologists. We're never going to have enough child psychiatrists. We're never going to even have probably enough licensed clinical social workers. We are never going to have enough therapists in these areas. And so by having this workforce that is trained to be able to go in there and supplement and be able to treat kids early on, we can avoid, the escalating problem until it reaches a crisis level. And we can also identify those kids that need treatment earlier on and get them to our limited resources that we have. So it's not only just a general degree, but it comes with more specialized training. So thank you.
Thank you so much. And we are going to go to Senator Lang.
Okay, thank you, Madam Chair. I just have a couple questions, and I think one of them you've already stated, but I want to make sure it's on the record. So can someone without an advanced degree do this type of work?
Tara Rains, for the record, absolutely. This degree, this profession is designed to be a bachelor's level workforce. And what's super sexy about this is compared to other bachelor's level mental health workforces, this workforce, the way we're designing the training with our 3 universities, it would look like 2 years of coursework and 2 years of coursework with fieldwork integrated. So we know that at a lot of undergraduate mental health programs, they graduate from the program having never worked with a child or a family, and they're having to learn on the job really quickly how to support children and families. And so these folks will be leaving their degree program with some of that experience.
Can I go ahead?
Yep, one more question from Senator Lang.
So we know that we have community health workers, and how would these bachelor level degrees be different from our community health workers?
Thank you, Tara Rains, for the record. So we know that the community health workers do excellent work in our community, and we also know that the requirements to be a community health worker is a high school diploma, and they take a workshop to get the skills. This is a more intensive training program and a more intentional training program. We see this as a program that perhaps people who have a high school diploma and their community health workers can take as the next step to build their training and build their ability to support children and families. Thank you.
Thank you so much. And Senator Steinbeck.
Thank you, Madam Chair. I have 2 questions, if that's okay. First one, first of all, thank you for bringing this. I've already expressed my support for this. Can you expand on the partnership and the organizations you've worked with in developing this legislation? There's so many stakeholders that this touches.
Absolutely. Tara Rains, for the record. So our primary partners, this legislation was born out of our Children's Mental Health Action Coalition. And as Senator Nguyen said, we had, at our initial meeting, we had about 70 practitioners, family members, trainers, people from Southern Nevada who care about children's mental health. And workforce rose to the top of the needs that we have here in the state. And within the research that we did after they said workforce has to be addressed, we partnered with the Balmer Institute, and we have their government affairs director on Zoom as well who can help. And we learned that what they were doing in Oregon was innovative, but it wasn't brand new. So the idea actually came from the National Health Service in the UK. And they've been doing this for quite some time there and demonstrating that if they can engage in prevention work, if they can use a bachelor's level workforce to help folks before the full blossoming of mental health disorders, that they've got fewer folks that are escalating all the way to needing severe mental health support. And so with that information, we reached out to our universities to see if there was an appetite. Great Basin College has been an excellent partner. They recognize that this is an area that could really support rural Nevada. And so they have been incredibly excited about partnering to do this. UNLV also expressed incredible support, and so did UNR. And so we feel like with our university partners and their commitment to this, that we should really be able to help these professionals flourish quickly. And also, as far as developing a training program, we've been partnering with the Balmer Institute. They've been fantastic in helping us better understand how to develop the objectives and the course sequence for this degree program. And that's important because it also allows for some transportation, right? Like, we don't want to lose anyone in Nevada, but we also want to be able to take the people from Oregon, sorry, Balmer, and have those folks, as they graduate, able to help support our workforce sooner rather than later.
Thank you. And a follow-up, please. 911 and our emergency rooms, they have a role in mental health support, certainly. However, unfortunately, it's become the default quite often. How do you see this assisting with alleviating that?
Tara Raines for the record. So if we can catch the kids early, if we can support them early, there should be fewer using emergency rooms. One of the other things that we're hoping this professional can do is be a connector, right? So when that kid comes into the Boys and Girls Club and they are demonstrating, behaviors that might indicate a mental health disorder, these folks would be able to say, like, I don't know what this is, but I know it's bigger than my training. And so Mom and Dad, let me help you find some support in the community, right? Like, let me help you navigate a little bit of that. So we're really seeing that in theory, and hopefully that will reduce the number of folks going to the emergency room to receive medical care or mental health care.
Thank you. Thank you.
All right. Thank you so much. I'm going to ask a few questions as well. And again, thank you so much for the presentation, for coming into the office to meet yesterday. And I had been looking forward to this presentation, so I'm happy we're here. I do have a few questions for the Balmer Institute, but before we do that, I was just curious how many child psychologists you expect to graduate each year and how many BA graduates you might expect to graduate.
Tara Raines for the record. So I can speak to the BA graduates, and then I'll let Dr. Paul speak to the child psychologists. So right now at just UNLV, and we know there are some at Great Basin and some at UNR, but at just UNLV, there are about 2,000 undergraduate psychology majors. So if only a fourth of those students decide, hey, I'd like to do this behavioral health and wellness program instead of a traditional psychology degree, we would have about 500 behavioral health and wellness practitioners like out the gate. So you'll also notice in our bill, we have built in a mechanism for supervisors, right? Because what we don't want is 500 of these folks going out into the world and living without qualified supervisors. And so we've also built in a supervision program that should yield us between 150 and 200 supervisors a year. And those are folks who are already licensed mental health professionals who would be willing to take on these practitioners to support them in their practice.
With respect to the psychologist workforce, so we're starting at baseline at today needing to double that workforce from 600 to about 1,200. The current status of the doctoral training programs in Nevada, they will graduate in any given year about 20 psychologists, and not all of those are child-oriented, and many of them are nationally and internationally recruited, so they leave the state. Currently, through the Fund for a Resilient Nevada, UNLV received a grant to launch a new doctoral training program to build child psychologists, and that program is expected to graduate with its first couple of cohorts around 20 to 25 per year. So the internship is going to be needed to be built in the state, not only to support our colleagues at UNR and UNLV in the existing programs, but also to build capacity for the new doctoral training program. And so that internship is going to have to scale up alongside to be able to recruit and retain at least 20 interns per year.
Rochelle Wynn for the record. It's also our intention, and it was very intentional on how these two programs were kind of developed together. I mean, the idea that we could potentially have 500 new people in this new profession is pretty, that's what makes this so like revolutionary for our state and for the development of that workforce program. What also makes this bachelor level degree extra special is that essentially 2 years of clinical work. It's very much hands-on on a bachelor's level degree. Also, it's our intention that people will get into this profession at a bachelor's level degree and realize that they want to go on and get their master's, or they want to get their PsyD, or they want to go on and further like their education. So we will see like an increase in these other populations. And when she talks about 20 people, that's 20 people that are graduating from the program. It doesn't mean, again, that they are working in children's mental health, and it doesn't mean that they're staying here in Nevada. So that's kind of our intention holistically in the approach to this bill.
Thank you so much. And a couple questions. I believe on Zoom, we do have someone from the Balmer Institute. So if you'd like to turn on your camera, a few questions. I'd love if you could, thank you, welcome. If you could share some examples of how the Institute has trained behavioral health specialists that are supporting children and families and communities.
Good morning, Chair Pazina and members of the committee. And I'm not sure if you want me to do my testimony now or if I should just go into the questions.
I think just questions.
Perfect. Okay. My name's Courtney Westling. I'm the Senior Director of Public Affairs for the Balmer Institute here in Portland. Thanks for having me this morning. So to your point, and you may need to read it again because when I asked my question, I think I forgot yours.
Well, welcome. We're happy to have you today. I was just curious if you could share some examples of how the Institute has trained behavioral health specialists that are supporting children and families in the community. And thank you.
Yeah, thank you. And again, Courtney Westling, that's Courtney, last name Westling, Westling. We have our first cohort of juniors. So this is a 4-year bachelor's level program. They spend their first 2 years really doing core curriculum like any college student would do to be a well-rounded human. And then we compress their last 2 years of college, and it's very heavily practicum focused. So we have our first cohort of juniors right now in Portland doing practicum training in schools. That is their first first training opportunity is in our school district here, and we have a couple partnerships with school districts in Portland. And so it's not a Tuesday or a Thursday, so they're not in schools today. They're in class today, but they are already working with youth under supervision in middle and elementary schools as we speak-ish this week. So that's one partnership that we've already set and is moving forward at full speed. We have a community advisory board that is helping to guide our work. That is leaders from a lot of our community-based organizations in the area. They are very interested in ways to partner more fully to have our students in their system, in their physical locations, offering services and helping to train their staff. So that's another example of partnership that we're working through. We also currently have one of the practicum opportunities, and I think some of the folks from Nevada have seen this, or we talked about it, I should say. We have a partnership with Lines for Life and their youth line, which is a crisis line that offers opportunities for students or young people to call in if they're going through something. And, there's a whole spectrum of what they could be going through. A relationship issue, or in some cases, suicidal ideation. And they call in and they talk to peers. So we have a co-located call center on our campus. So our students are also training on that crisis line, because even though they're working at the tier 1 and tier 2 level, as has been discussed when we're talking about the MTSS system in schools in particular, they're also going to encounter kids who are in a crisis. So learning on that youth line is another way that they'll be prepared no matter what comes their way. So that's an exciting partnership that we're really happy and proud of.
Thank you so much. I have one more question for you, and thank you so much for being available today to us over Zoom. How would you say that the Institute's micro-credentials help expand access to behavioral health training, and what are people learning in those courses?
Yes, Chair Pizzina, great question. Again, Courtney Westling for your record. So we are serving currently our 3rd cohort in our graduate micro-credential program, which is a program designed for current youth serving professionals. So they're already working with youth, but might need or benefit from additional skills. I used to work for our school district in Portland, and I learned that, hey, guess what? There's not enough time in the day for teachers to be trained in this. So we're offering an opportunity for our educators to be trained in things like trauma-informed supports, self-regulation, developing and maintaining healthy relationships, so that they can take skills from a Zoom class, and this is all an online offering, once a week for a full academic year. They can take a class on a Tuesday night and go to work on Wednesday and use those skills in the moment. And it's been, we've been getting great feedback. Like I said, we're in our 3rd cohort. We're excited about the Great Basin College Education Department. They're planning to offer micro-credential to rural communities in Nevada, because we know that that's a harder place to reach and there are fewer resources in rural parts of your state and ours. So that's an exciting development. And I think what we're hoping is that we can grow that program as an opportunity for folks who aren't necessarily in an urban setting to get access to skills that will help them in their work that might not be available just because there are only so many hours in the school year or school day and school year.
Thank you so much. And I think that concludes our questions on Senate Bill 165. We thank all 4 of you so much. And Dr. Raines, I have to say I love all of the Nevada jewelry today as well. Thank you very much. We'll have you step back from the table, and we will open it up in testimony in support of Senate Bill 165. We welcome you to our physical locations in Carson City, which is where we'll start, and then move to Las Vegas if we have anyone there, and then to the phones.
Thank you, Madam Chair, members of the committee. Connor Kane with Carrera Nevada on behalf of HCA and Sunrise Hospital and Sunrise Children's Hospital in support of Senate Bill 165. Sunrise Hospital and Sunrise Children's Hospital is our state's largest safety net hospital, caring for roughly 1 in 5 Nevadans covered by Medicaid and 1 in 4 Medicaid recipients in Clark County. Those are big numbers, and as you all know, we're really, really proud of that. Sunrise Children's Hospital is a 200-bed women and children's facility that sees the most vulnerable kids in our community in its pediatric emergency room. Sometimes these patients have behavioral health needs. We support Senate Bill 165 because this new practitioner type would place value around the wellness and primary prevention of mental illness in children and help our providers in the identification of delayed development to get services aligned earlier so that we can get our kids the right care at the right time. We encourage your support of Senate Bill 165. Thank you.
Madam Chair, members of the committee, for the record, my name is Annette Magnus, and I'm here today in support of SB 165 on behalf of Moms Rising Together. Moms and families understand better than most the critical importance of a strong child behavioral workforce. A strong mental health system for our families doesn't just treat problems, it prevents them. Investing in behavioral health and wellness practitioners will ensure our children and families have access to early intervention, mental health education, and preventative services, keeping our families healthier and more kids from reaching crisis levels. We urge your support. Thank you.
Good morning, Madam Chair, members of the committee. My name is Nathaniel Waugh, Director of Government Relations for the Clark County School District, to express our support for Senate Bill 165. This bill aims to address Nevada's critical shortage of mental health professionals, particularly for children, by creating this new category. The Clark County School District recognizes the growing need for mental health support among our students. By introducing this new role, SB 165 has the potential to expand access to timely, developmentally appropriate services that emphasize prevention before crises arrive. This proactive approach aligns with our efforts to support students' well-being and academic success. Importantly, we understand the role of behavioral health and wellness practitioners is intended to complement, not replace, licensed mental health providers. The bill appropriately restricts this position from conducting assessments, diagnoses, or interpretations, and requires supervision by qualified licensed professionals. We support the broader goal of strengthening Nevada's behavioral health workforce and enhancing the access to preventative and early intervention services for children. Thank you very much.
Good morning, Chair. My name is Vincent Guthrow. Last name is spelled G-U-T-H-R-E-A-U. I serve as the Executive Director of the Nevada Association of Counties, or NACO. We're the statewide association that represents all 17 of Nevada's counties. We support SB 165. We want to thank the sponsor for bringing this forward. Every county in Nevada is a mental health professional shortage area, and as the social safety net, Nevada's counties bear much of the responsibility for emergency and crisis response, along with through our human services programs and public safety. Given this, our counties support innovative upstream efforts for workforce development. Thank you.
Good morning. My name is Shauna Tello, S-H-A-N-A-T-E-L-L-O. I am the Academic and External Affairs Administrator at University Medical Center, and I'm also a member of the Children's Mental Health Action Coalition. I'm speaking in support of SB 165. We need to build our children's mental health workforce. This includes licensing prevention-oriented practitioners, investing in scholarships to increase the number of behavioral health practitioners, and investing in a child psychology internship program. To personalize this from a parent's perspective, let me share some insight. These children become adults. I will share with you that my grandfather was diagnosed with schizophrenia at age 42 and committed suicide, and now I am a parent of one of those adult children with a mental health diagnosis. My daughter did not choose her disease. She was an honor roll student. She graduated from Cornell University. She went to St. Mary's on a full scholarship, and stress, environmental factors, life choices, along with genetic predisposition was the perfect storm for her mental break. This has persisted for many years and led to significant life challenges. It's important to view mental illness the same as we view other diseases like hypertension, diabetes, and cancers. Mental health is part of physical health. And there's also the stigma and shame. These perceptions create embarrassment and reluctance of individuals to seek and receive help. I am and I'll continue to be an advocate for my daughter and my community. As a leader in the healthcare industry and a mother, I struggle to navigate and identify services for my own daughter. From a parent's perspective, how will my daughter navigate this system on her own when I'm no longer here? Will there be services for her, or will she become homeless? Will my daughter be treated with dignity and respect despite her illness? These are some of the thoughts, fears, worries as her mom. I believe that increasing the behavioral health workforce and by addressing the lack of providers, this will be the key to ensuring access and optimizing outcomes for Nevada's children. Finally, Las Vegas is so fortunate to have you all as amazing visionary and dynamic leaders that are committed to remaining steadfast in the design of a system to care for this population. Thank you so much.
Thank you, and thank you for sharing your family story.
Good morning, Chair Pazina, members of the committee. For the record, my name is Cadence Matijevich, C-A-D-E-N-C-E-M-A-T-I-J-E-V-I-C-H, with Washoe County. Washoe County is focused on increasing access to behavioral health resources in our community. 500 new practitioners sounds great to us. We thank the Senator and the proponents of the bill for bringing it forward, and we ask for your support for SB 165.
Again, my name is Robin Reedy, and I'm with NAMI Nevada. That's the National Alliance on Mental Illness here in Nevada. It should come as no surprise that we are in favor of this bill. There are so many families out there trying to access pediatric psychiatric needs, and they're unable to, whether it's money or whether it's just availability of someone. We've been working with the peer recovery support specialist system and the community health workers, and as someone said earlier, we need the right services at the right time, and this bill will help support that. Our national NAMI, part of their strategic plan, is to get services and identify people earlier rather than later. It will save money in the long run and save lives. Thank you.
Good morning, Chair and members of the committee. Allison Herzik, Director of Government Relations for Dignity Health St. Rose Dominican, for the record. We're here today in support of Senate Bill 165. We recognize the ongoing need for behavioral health services in Nevada, particularly for children, as well as the importance of expanding healthcare workforce opportunities. We believe this bill is a meaningful step forward towards addressing both of those critical needs. We sincerely thank Senator Wynn and the Children's Advocacy Alliance for their leadership and efforts on this bill, and we look forward to seeing the bill's passage and positive impact it will have on our community. Thank you for your time.
Good morning, Chair and members of the committee. Thank you for the opportunity to speak in support of this bill. I am Will Rucker, Community Health Director for Intermountain Health. That's WILLRUCKER. At Intermountain Health, we strive to help people live the healthiest lives possible. We've worked diligently with many organizations here in Nevada to identify health needs and to assess the assets in our community. Our Community Health Needs Assessment recognizes that mental well-being is a significant health need for our community, and we are committed to making steps to improve this. As we work towards building Nevada's first comprehensive standalone children's hospital, one of our primary areas of focus is behavioral health. This bill will help bridge the workforce gap that exists and provide a resource that is desperately needed here in Nevada for adults and children alike. We know that behavioral health is not just a healthcare issue, it is a community issue. And together we can work and create a healthier, more resilient Nevada, developing long-term community well-being by intervening before crises arise. We encourage you to support SB 165. Thank you.
Hello, can you hear me? Madam Chair and Senators, my name is Eugenia Weiss, for the record, EUGENIA Weiss, WEISS. I am an Associate Dean of the School of Social Work at the University of Nevada, Reno. I am also a clinical social worker and a clinical psychologist. I am here to support AB 165 and let you know that clinical social workers provide 60% of mental health care in our entire nation. And we at the University of Nevada, Reno, educate and train most of the social workers in the state. Right now, we have about 800 social work students, bachelor's, master's levels, and we have graduated thousands of them since the late 1970s. So I'd like to say, because of our online and our on-ground programming, again, the only one in the state, we're able to reach the rural communities. Many of our students come from the rural communities in Nevada, and the scarcity of services there you already know about. And we also, in terms of working on this initiative, we will work collaboratively with the University of Nevada in Las Vegas and Great Basin College to create the bachelor's degree in behavioral health and wellness practitioners, as well as provide the micro-credential to prepare these practitioners to meet the needs, the behavioral health needs of children and youth for the state of Nevada. We are uniquely positioned to be able to carry this out. I also want to thank Councilman Knudsen for his support on this bill and tell you from a personal perspective, I am the mother of a child who has been through horrendous mental health challenges. She was diagnosed in school when she was an adolescent with several conditions, very severe mental health conditions. As a result of that, she ended up in the juvenile justice system, and then we had to lock her up in a residential care facility, the highest level facility, in order to keep her from attempting suicide. And I just want to say that if we would have had these prevention behavioral health specialists at the schools early on, I believe that all of this could have been prevented. Now, I am highly educated. I have 2 doctoral degrees.
Thank you so much. We're well over the 2 minutes.
Oh, thank you.
But if you'd like to finish up, you're welcome to.
Yes, thank you so much. I just want to say that with all the education that I had, I wasn't able to prevent it. And only because there were just not enough services and not enough practitioners. So this is a very important initiative. Thank you.
Thank you, and thank you for sharing your story. If everyone can keep it to 2 minutes, and if you're saying something similar to someone else, you can also say me too. Thank you.
For the record, Andy Bischel, Boys and Girls Club CEO, Southern Nevada, BISCHEL. Here in support of Bill SB 165. We started in mental health services just before the COVID pandemic. We noticed that we were having challenges with our kids and worked with DHHS to bring licensed professionals onto site so that we could provide these preventative resources. And the second piece was, how do we pay for those positions? So we became credentialed to bill Medicaid and private insurance to create sustainable funding around those positions. But when we became credentialed in 2021 and posted our jobs, no one applied. No one applied because there's not enough licensed mental health professionals in our community to fill those positions. Undeterred, we went back and said, can we become a practicum location for those services? And we opened a pipeline with UNLV to be a practicum placement to grow our own and put them on contract once they get to licensure. So this next step is providing that lower level tier where we can provide more access for mental health services to our youth. Thank you.
For the record, Sarah Negrete, Vice President at Great Basin College, speaking in favor of this bill. In partnership with UNLV and UNR, Great Basin College's involvement will help ensure that rural Nevada students have access to this vital opportunity to enhance the behavioral health and wellness workforce. We know that when we cultivate local talent, that talent is more likely to remain and serve in the communities where they live. Investing in behavioral health and wellness practitioners is essential to providing children and families with early intervention, mental health education, and preventative services, resources that are critically needed and in short supply. Thank you.
Good morning, Chair Pazina and members of the Senate Committee on Commerce and Labor. For the record, Leonardo Benavides here on behalf of UNLV, proudly in support of SB 165. Mental health is a priority for the President Whitfield and UNLV this legislative session, and nowhere is that more evident than the work that the practice is doing in our Southern Nevada community. But we need support, especially at an early enough level to spot emerging issues before they become a problem, and we need a workforce that can identify them. That's why UNLV is proud to support this bill and work alongside UNR, Great Basin, and NSHE to help stand up the bachelor's program for behavioral health and wellness practitioners and the accredited internship program for child psychologists. We all understand the need to grow and develop this workforce and feel equipped to do it to meet the needs of our children and the state as a whole. That's why we're glad Senator Wynn and other leaders such as Councilman Brian Knudsen are leading the charge in this important conversation and why we're here in support of this bill. Thank you.
Good morning, Chair Pazina and committee members. For the record, my name is Noe Orozco. That's N-O-E, accent over the E, O-R-O-S-C-O. And I'm the Government Affairs Manager for Make the Road Nevada. We're here in support of SB 165. Early intervention and preventative services play a crucial role in mitigating the severity of mental health issues before they escalate. Yet many of the families struggle to find the adequate support. We have members that have actually had to travel out of state to seek some to care for their children just because they were unable to find the
to identify the issues early on. So we do support this measure, and we really urge your support for SB 165. Thank you.
Thank you so much. If you have similar comments, it is okay to say me too. We appreciate all the support, though, and thank you.
Thank you, Madam Chair. Dan Muska with Strategies 360, representing the Valley Health System of Hospitals, as well as UHS, which includes 2 mental health hospitals, West Care, Miracle Minds Therapy, Me Too.
Thank you.
Thanks, Madam Chair. Bradley Mayer, representing Raise the Future. Raise the Future is a nonprofit that partners with child welfare agencies across the state to find permanency for foster youth. And of course, we support 165 because of the workforce pathway it creates. Of course, a lot of our youth struggle with this, and we are constantly looking for ways to expand the early intervention, mental health education, preventative services, as families are taking in foster youth and working with them for permanency. So thanks for your support.
My name is Andrew Clark, C-L-A-R-K-E. Unlike the county, I'm here on behalf of New Day, Nevada. We fight for policies that benefit working families and are invested in economic justice, especially in the healthcare field. Because this expands access to healthcare, we are strongly in support and ditto to about 90% of the comments.
Thank you so much. Do we have anyone seated at the table? It may just be me getting really old and having terrible vision. I don't see anyone at the table in Las Vegas, and I believe that the Ballmer Institute wanted to make a... Oh, I do see a few people coming up to the table. While they're coming up, and please do be quick, and please do say me too if it's similar. I believe the Ballmer Institute wanted to say something very, very quickly on Zoom in support as well. And if that's the case, please turn on your camera and begin when you're ready.
You want me to go first? Okay. Chair Pazina, Vice Chair Daly, and members of the committee, for your record again, Courtney Westling, Senior Director of Public Affairs at the Ballmer Institute for Children's Behavioral Health at the University of Oregon. I'm excited to join you today to share our support for Senate Bill 165, which creates the behavioral health and wellness practitioner role in Nevada. Just like here in Oregon, Nevada is facing behavioral health workforce shortages. Then we just simply do not have enough well-trained professionals available to meet the needs of our kids. The Ballmer Institute launched in Oregon in 2022, creating a new bachelor's level mental health profession, the Child Behavioral Health Specialist, to support and grow the behavioral health field. We know that a strong mental health system doesn't just treat problems when they become a 5-alarm fire, it prevents them, which is why investing in a prevention-oriented workforce is key. Our child behavioral health specialists are being trained to support youth behavioral health through early identification, promotion, prevention, and brief intervention, an innovative approach to a long-standing gap in mental health services for children and families based on a model in the United Kingdom. There, they've seen the development of a bachelor's level behavioral health workforce that has led to substantial increases in access to care. Evidence from the UK program has consistently shown that individuals at the bachelor's level deliver high-quality care with positive impacts on the mental health of individuals they serve. Investing in behavioral health and wellness practitioners will ensure children and families have access to early intervention, mental health education, and preventive services, keeping more kids from reaching crisis levels. We're thrilled that your universities have been in contact with us and will be participating with the Ballmer Institute to streamline both scope of practice and instructional standards, so this career will be portable should people decide to leave Nevada, but we hope that they stay there and that we keep ours here. Here in Oregon, we have seen overwhelming support for this new workforce from employers, including schools, pediatric primary care, community mental health, and community-based organizations. Senate Bill 165 is an important step toward addressing the pressing shortage of behavioral health professionals and getting folks into the workforce faster. Thanks for your time today. Really appreciate it.
Thank you so much. We're going to move to Las Vegas, and I would ask that everyone keep their testimony and support brief and offer a Me Too if they can. Thank you.
Good morning, Madam Chair and committee members. My name is Jacqueline Eddy, JACQUELINEEDDY. For the record, this testimony is in support of SB 165. I am a doctoral student in the school psychology program at UNLV, and I have devoted the last 7 years of my life to training as a mental health professional, specializing in providing services to children and their families. Las Vegas is my home, and I am deeply committed to serving the families and children in our community. When I reached the stage in my training to apply for internships, I was faced with a difficult choice of foregoing an APA-accredited internship because no program exists in Nevada. As a single mother and non-traditional student, I could not leave the state due to significant financial burden for relocating and not having family support. Currently, I am completing my internship at the UNLV practice, and although my training and supervision has been exceptional and the program meets NAC and APA standards, it is not APA accredited, largely due to the lack of adequate funding and support. APA accredited internships are often necessary for jobs in child mental health. Despite putting in the same effort as my peers during my training, my future career options will be limited because I could not secure an APA accredited internship locally. I will also be faced with the additional burden of extensive documentation when I am ready to apply for licensure. Nevada is experiencing a mental health crisis. We can tackle this issue by ensuring that students who have completed their graduate training in our community have access to APA accredited internships locally. This will help our state retain talented mental health professionals. Please invest in APA accredited internships and scholarships for students studying mental health. We want to stay in our community and we aspire to use our training to make a difference. Thank you for your time.
Okay, thank you so much. A reminder to please keep your testimony very, very brief. Offer a me too if you can, and we thank you so much for being in Las Vegas today.
Good morning, Madam Chair. My name is Brian Knudsen. I am nervous to be here right now, but I just wanted to let you know that I am a proud parent of 2 adopted children, Andrew and Kate. And when Andrew started experiencing some mental health issues, there was no one who understood how to talk to me about it. At that, I started finding friends, and I reached out to get a diagnosis. It was going to be about a 1.5 year wait. I jumped the line because of my privilege and my access. To get occupational therapist was going to be more than a 18-month wait. I could not jump that line. That doesn't exist here for anybody. With the challenges that I experienced, as Senator Wynn mentioned, and I'm a grateful resident of her district, I pulled together as many people as I could to help me. And what you see today is the outpouring of people who are not unique. I'm not the exception in Nevada. This is the rule that we all struggle with this, no matter our class, no matter our privilege. The SB 165 provides us an opportunity to be better. So, Madam Chair, with incredible gratitude and at the bottom of my heart, me too.
Thank you so much, Council Member, and thank you for bringing this to Senator Wynn and starting this conversation, which finds us all here today.
Good morning. Good morning, Chair Pazina and members of the committee. My name is Randolph DuPont, RANDOLPH, DUPONT for the record. I'm testifying in support of SB 165. I'm a psychology graduate student at UNLV, pursuing a career in clinical mental health and behavioral health. I'm here today because the financial barriers to entering this field are making it harder for Nevada to build the workforce we desperately need. Graduate education in psychology is incredibly expensive. Students take on tens of thousands, sometimes hundreds of thousands of dollars in debt just to complete the training required to become licensed providers. And even after years of coursework, we are forced to leave Nevada to complete our required APA accredited internship because there aren't any in-state options. This not only increases our financial burden, but also makes it harder to return and serve Nevada's children. If we want to attract and retain talented mental health professionals, we must invest in both APA accredited internships and scholarships for students. Without these investments, Nevada will continue to lose highly trained providers to other states, worsening the already critical shortage of child mental health professionals. I urge you to take action. Fund APA accredited internships and provide financial assistance to students pursuing career in child mental health. If we want to build a strong workforce for the future, we need to start supporting the next generation now. Thank you for your service.
Please begin and keep it moving when you're ready. Thank you so much.
Oh, I'm sorry. Sorry about that. Hi, good morning, members of the committee. My name is Amy Novak. I've been a resident of Southern Nevada for 26 years. I'm here today as a mom, a business owner, and a longtime educator in our state. As a mom, I raised my 3 children here with the hope that after completing their education, they would find their purpose and passion in their careers and ultimately return to Nevada to contribute to their communities, just as I have. However, I stand before you today with a very heavy heart. My eldest daughter, a brilliant college graduate, dreams of becoming a neuropsychologist and working with children in the behavioral and mental health field. Despite her deep roots in Nevada, she is forced to look elsewhere for her future. The reality for her is stark. She's applying to 11 graduate programs, none of which are in Nevada because our state lacks an APA-approved internship opportunity in her field. This means that once she leaves for graduate school, she will likely set down roots elsewhere and never return to practice in Nevada. This is not just a personal loss for me as her mom, it's a loss for our entire state. She was born for this field, and to help children, it shows in every commitment she has made. As an educator who has spent decades working with children throughout southern and northern Nevada, I've witnessed this pattern far too often. We are raising and educating talented, passionate young professionals only to watch them leave because we do not have the infrastructure to support their advanced education and careers. The cycle must end. We need to invest in our homegrown talent by creating accredited programs and internship opportunities in Nevada. If we provide the necessary resources, these students will stay, completing their education here and reinvest in our communities as practicing clinicians. Without this continuity, we will lose our best and brightest to other states. In my household and my schools, we believe in fulfilling our purpose and giving back to the community. But to make that a reality, we must ensure that our young professionals have the opportunities they need to stay and thrive in Nevada. I urge you to take action and prioritize investments in these programs. Let's make Nevada a place where our talented youth can build their futures, serve their communities, and contribute to the well-being of our state. Thank you for your time.
Thank you, and thank you for sharing your child's story, and I agree. I hope we can keep everyone in state. Our next speaker.
Good morning, Chair Pizzina and members of the committee. For the record, my name is Laura Meyer, Laura-Meyer, representing communities and schools of Nevada, testifying in support of SB 165. Communities and Schools of Nevada serves over 100,000 students in 118 schools across the state in rural and urban communities. Our goal is to serve all high-need schools across the state, over 400 schools. CIS of Nevada is excited for the impact that the behavioral health and wellness practitioners could mean for our workforce. We are both a potential employer for graduates of this program and a potential practicum site for students enrolled in this program. Health professionals with the knowledge of child development, health promotion, and mental health care can increase our ability to serve more youth and families across the state. We see this workforce development as a key to the success of students across Nevada. Thank you so much.
Good morning, Chair and members of the committee. My name is Joaquin Alvarez Bautista, JOAQUINALVAREZ-BAUTISTA. For the record, this testimony is in support of SB 165. I am a doctoral school psychology student at UNLV, and I've spent the last 6 years of my life training to work as a mental health professional with children. Currently, I work as a graduate assistant at the Psychological Assessment and Testing Clinic at UNLV Practice, where one of my primary responsibilities is providing consultations to families seeking psychological assessment services. I'm intimately aware of the level of need in our community, and I'm passionate about working with children and families here in Nevada. But the sad fact is that due to our limited resources and clinicians, we're not able to meet these needs. I'd love to build my career here in the state of Nevada. However, the jobs and postdoctoral fellowships that I want require an APA accredited internship as criteria for employment. Last week, 7 of my peers matched to psychological training programs that meet these criteria, all of them out of state. Therefore, next year, Nevada will lose 7 exemplary school psychologists that have trained within our communities. Likewise, I will have to leave the state when it comes time for me to begin my internship. Graduate school is an enormous financial burden. Between tuition fees and the cost of living, students take on overwhelming debt just to pursue this work. Without in-state internship opportunities, we're forced to relocate, sometimes across the country, adding even more financial strain. And once we've moved, finding a way back isn't always easy. The likelihood of me returning to Nevada is slim to none. If we want to keep homegrown talent, we need APA accredited internships and scholarships to support students who are committed to serving the children and families of Nevada. Otherwise, we will continue to lose highly trained professionals simply because they can't afford to stay. I urge you to invest in accredited internships and financial support for psychology students. Thank you for your time.
Good morning, Chair and members of the committee. My name is Erin Dunn, ERINDUNN, for the record. This is in support of SB 165. Similar to my good friend Joaquin. I am a doctoral student in the school psychology program at UNLV. I've spent the last 3 years working under excellent supervision here, including Dr. Paul. I've worked with the UNLV practice, also communities and schools, under grant providing telehealth to youth up in Elko and Humboldt counties. And I currently am a practicum student at Boys Town Behavioral Health, where I give behavioral health, mental health services, and do autism diagnostic testing. And I will basically say me too, and emphasize that in probably about July, I will be moving to Minnesota for my accredited internship, as there is not one here in Nevada. And as I would like to return, the chances are not very high. And so the families that I work with, the kids that I really love in this community and this state, I won't be able to have the opportunity to keep serving them due to the financial constraints and the availability of training elsewhere. And so I encourage the support of this bill. And if we don't act now, we risk losing an entire generation of qualified mental health professionals to other states. I assure you to make this investment and help us stay in Nevada to do the work we're trained to do. Thank you for your service.
Thank you so much for your testimony, and we do hope you find your way back, and we appreciate your support of Senate Bill 165. Do we have anyone else at the table in Las Vegas? If so, please begin, and thank you.
Yes, thank you. Good morning. I'm Daniel Archer. I currently serve as the Vice Chancellor for Academic and Student Affairs, the Nevada System of Higher Education, otherwise known as NSHE. NSHE supports Senate Bill 165. There's a clear need to expand children's mental health services, and higher education is essential to training the workforce needed to meet this important challenge here. And Senate Bill 165 provides the infrastructure to support these efforts, so NSHE is 100% on board.
Thank you very much, Vice Chancellor. It was so wonderful to hear from a number of the students involved in higher education in the state. Let's move to the phone lines. Not seeing anyone else at the table right now in Las Vegas. Anyone on the phone lines broadcast in support of Senate Bill 165?
If you'd like to testify in support of SB 165, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 304, please press star 6 to unmute yourself.
Dear Committee Chair Pazina, Vice Chair Daly, and members of the Senate Commerce and Labor Committee, my name is Chelsea Bishop with Act for Kids Nevada. As an advocate and hearing from many families, we give a robust, us too, we are in full support. This is wonderful, and our typed out testimony has been submitted. Thank you so much.
Thank you. I love that testimony. Next caller, please.
Good morning, Chair Pazina and members of the committee. My name is John Etzel, Executive Director, Boys Town, Nevada, JOHNETZELL. I am in support and ditto, in particular, on behalf of Erin Dunn, who testified just a few minutes ago. We want her to be able to come back to Nevada and practice here. Thank you very much. Have a great day.
Good afternoon, Committee Chair Pazina, Vice Chair Daly, and members of the committee. My name is Rebecca Acosta, and I respectfully submit support for SB 165, both as a professional working in pediatric healthcare and as a parent. As a board-certified patient advocate, I work with youth and their families to ensure a young person's physical, mental, and behavioral health needs are met wherever they go. Professionally speaking, the most difficult cases for me to work on involve young people with mental or behavioral challenges. Not because of the child or family, not because of the diagnosis being scary, overwhelming, or complex, but solely because as an advocate, I cannot assist these youth and families as I normally would due to the extreme shortage of mental health providers for children. Nevada's mental health workforce is at a true breaking point, and our young people are paying the price in staggering numbers. I wholeheartedly fear we have created a generation of young people with unmet health needs, which will hand out severe consequences to our society for decades to come. Nevada's youth need and deserve well-qualified professionals to provide preventive and supportive services to meet their mental health needs now, not in 10 or 20 years. The state of mental and behavioral health in Nevada, especially for our most vulnerable population, demands immediate action. Perfect should not be the enemy of good if we intend to truly redirect this train before it fully derails. My sincere thanks to Councilman Knutson and Senator Wynn for bringing this legislation forward, and to everyone at Children's Advocacy Alliance and the Children's Mental Health Action Coalition for continuing to light the fire. On a personal note, I'm the mother of 2 teenagers who have needed mental health treatment at various ages. Despite my profession, access to information and professionals, and knowledge of the healthcare system, my children suffered long wait times, and our family felt alone through the process as we did our best to manage stressors, behaviors, school, and work. Thank you again for your consideration, and me too, us too, ditto, let's go, SB 165. Thank you.
Hello, Chair and members of the committee. My name is Troyce, Troyce, Krumme, Krumme. I am the current chairman of the Las Vegas Police Managers and Supervisors Association, and we represent the sergeants, lieutenants, and captains of the Las Vegas Metropolitan Police Department. The LVPMSA supports Senate Bill 165. Many subjects that end up in the custody of the police suffer from some type of mental illness, which likely played a role in the crime they are accused of committing. In our state of Nevada, the Clark County Detention Center is commonly referred to as the state's largest mental health facility. This is a tragic state of affairs. This bill aims to increase the number of mental health providers by creating a new degree path through Nevada higher education to specialize in juvenile behavior health. If we can find a way to increase the possibilities of identifying and helping those suffering from mental illness as early in life as possible, maybe we can begin to reverse this trend. We urge committee support for Senate Bill 165. Thank you.
Thank you so much. Broadcast, do we have anyone else on the phones in support of SB 165?
Chair, you have no more callers wishing to testify at this time.
All right, not seeing anyone else in Carson City or in Las Vegas. Thank you so much for everyone who's shared personal stories here today, and we hope that as many students as possible and practitioners make their way back to the state. We will now close testimony in support of SB 165 and open testimony in opposition of Senate Bill 165, and we will go first to our physical location starting in Carson City.
Good morning again, Chair Pazina and committee. Shelley Capro for the record, representing the Nevada.
Is your microphone on, just to make sure?
It's lit up.
Okay, thank you.
Yeah, do you want me to hold it up higher? Okay. Good morning again, sorry. Shelley Capro with the Nevada Association of Health Plans. And we are absolutely in alignment with the crisis in Nevada with mental health. And we appreciate the opportunity to address a few concerns with the bill, particularly the potential impacts on the quality of care within the behavioral health continuum. While we appreciate the intent of the legislation, we believe the creation of another advisory board and licensure type may not effectively address the needs for quality improvement. The services outlined in the bill, such as rehabilitative mental health, peer support, case management, and community health work, are already covered under existing structures. The providers delineated as supporters within the bill already oversee such services, and the bill is not clear on how duplication of services will be addressed. And although Medicaid has addressed additional costs within its fiscal note, it is crucial to know that the fiscal impacts on the commercial market as well, particularly regarding increased utilization and the potential for fraud and misuse from duplicated services. Additionally, there is a network requirement in the bill that may conflict with existing providers who are already part of the network, offering similar or identical services. We look forward to collaborating with Senator Wynn and with others, and we look forward to coming up with a solution to enhance the quality of care without introducing unnecessary complexities or costs. Thank you.
Okay, thank you. Do we have anyone else here in Carson City in opposition or in Las Vegas in opposition? Seeing no one, broadcast, can you please go to the phones and see if we have anyone in opposition of Senate Bill 165 on the phone lines?
If you would like to testify in opposition of SB 165, please press star 9 now. Chair, you have no callers wishing to participate at this time.
Okay, we'll close out testimony in opposition of Senate Bill 165 and move to neutral. I had a feeling the Department of Insurance may be making their way back up. Anyone who'd like to testify in neutral, please come on up to the seats and begin when you're ready.
Good morning, Chair, members of the committee. My name is Daniel Giudici, G-I-U-D-I-C-I. I'm here on behalf of the Social Workers Board. We're testifying in neutral on the bill, Senate Bill 165. We are working with Senator Wynn and have had discussions with the other stakeholders. We also have submitted a friendly amendment. Thank you.
Thank you. Adam Plain, Nevada Division of Insurance. We are testifying neutral as a matter of policy on this bill. Did want to clarify, we did submit 2 fiscal note responses to the request, one on behalf of the agency, which was no fiscal impact as a result of the provisions of this measure. The other was a fiscal impact as to the state general fund through the federal defrayal process, which Senator Wynn had mentioned. I did supply some documentation that's been uploaded to Nellis in both narrative and PowerPoint form, so whatever suits your fancy as to how you like to learn. If anyone in the committee has any questions, the division's always happy to respond, and we have committed to work with the bill sponsor to give her feedback if she decides to make any amendments to language that may trigger federal defrayal. Thank you.
Thank you so much. Not seeing any questions from the committee, we thank you for coming up here today and for your work with Senator Wynn on SB 165. Not seeing anyone else at the table in Carson City or in Las Vegas. Broadcast, do we have anyone in the phone line on neutral on SB 165?
If you would like to testify neutral on SB 165, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to participate at this time.
Thank you so much. That'll close out our testimony in neutral. Senator, would you like to? Okay. So with that, we will close the hearing on Senate Bill 165, establishing provisions relating to behavioral health. And I would like to say thank you to everyone who came up here to the legislature this week on behalf of Behavioral Health Care Day. We really appreciate it. We really appreciate the testimony in regards to both Senate Bills 47 and Senate Bill 165. And with that, we'll move to our next agenda item, which is public comments. Members of the public may provide public comment in person, by phone, or submit written public comment to the committee's email address. Instructions for providing public comment may be found on the agenda, including the call-in information. We look forward to hearing your comments and ask that you keep them brief and avoid repetition made by previous speakers. Due to time constraints, we may have to move on to the next person who wants to provide public comment, and in such a case, we ask that you please send your public comment in writing to the committee's email address. Finally, clearly state and spell your name for the record. We'll begin with public comment from those in the physical locations and then move to anyone who is called in. Is there anyone in Carson City who'd like to provide public comments? Anyone in Las Vegas? Broadcast, do we have anyone on the phones?
If you would like to speak in public comment, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to participate at this time.
And with that, our perfect record of no one wishing to make public comment during Commerce and Labor since the start of session is intact. Any other comments from the members? Not seeing any, this concludes our meeting for the day. We look forward to seeing you back here on Friday, the 28th at 8 a.m. And with that, this meeting is adjourned.